You take them every night, just like the doctor said. One little pill to help you sleep, one to keep your blood pressure in check. You swallow them with a sip of water, turn off the light, pull up the covers, and hope that maybe, just maybe, tonight will be different. But a few hours later, it hits you. Hard. A sharp, sudden twist in your calf. Your leg locks up like it's turned to stone. You sit up, gasping, grabbing at the muscle, trying to stretch, trying to move, trying to breathe through it. It's 3:16 a.m. Again. And as the pain slowly fades, something else creeps in. A thought you've been ignoring. Why does this keep happening? You've stretched, you've hydrated, you've cut back on caffeine. You even tried bananas because someone on the internet swore it helped. But none of it worked. The cramps keep coming. And now you're starting to wonder, what if it's not what you're missing? What if it's what you're taking? What if the very pills you trust, the ones meant to help you rest, to keep you healthy, are quietly turning your nights into battlefields? In this video, we're going to uncover a connection that almost no one is talking about. A silent link between sleeping pills, blood pressure medications, and nighttime leg cramps. You're about to hear what the studies really say, what the side effects often don't warn you about, and why the pain you feel at 3 a.m. might not be random at all. Because millions of people over 50 are going through this exact same cycle, and most of them have no idea what's really behind it. But by the end of this video, you will. So stay with me. Let's talk about what's really happening after you close your eyes.
Let's talk about the pill that's supposed to help you rest. The sleeping pill. Maybe it's over the counter. Maybe it's prescription. Maybe it's something you only take on bad nights. But here's what most people don't realize. That little white tablet might not just be helping you sleep. It might be quietly changing the way your body manages blood pressure. In a long-term study from Spain, researchers followed over 700 older adults with high blood pressure. And what they found was shocking. Those who used sleeping pills regularly ended up needing more blood pressure medication over time, even though their weight, age, and lifestyle didn't change. More pills, higher doses, and worse control. Why? Because sleeping pills don't solve the root cause of your sleep trouble. They just sedate the brain. They don't ease your stress. They don't fix your circadian rhythm. They don't balance your nervous system. They simply turn off the lights without checking if the wiring is faulty. And that matters, because your nervous system plays a huge role in how your blood pressure rises and falls, especially at night. When you take sleeping pills, they can over-suppress the sympathetic nervous system. That's the part of your brain that helps regulate blood pressure while you sleep. Too much suppression, and your body loses its natural rhythm. The normal dip in blood pressure that should happen overnight can flatten out or become erratic. And in some cases, it rebounds, causing early morning spikes that your doctor may try to fix by increasing your blood pressure meds. So instead of healing the sleep problem, you're now treating a side effect of the sleeping pill as if it were a new disease. You see the pattern? Poor sleep leads to sleeping pills. Sleeping pills lead to more pressure instability. That instability leads to more medications. And all the while, the root cause, the true imbalance, remains untouched. This isn't a scare tactic. It's a warning, one backed by clinical data, one that too few patients ever hear about. Because if you don't understand what's really happening in your body at night, you can't fix it. You'll just keep layering one pill on top of another, hoping something sticks. But hope isn't a treatment plan, and silence isn't safety. That's why we're talking about this now, because the connection between sleep, nervous system stress, and blood pressure regulation isn't just real, it's personal. Especially if you're someone who takes both types of pills and still wakes up tired, foggy, or worse, in pain. So let's keep going, because things get even more tangled when we look at what blood pressure meds themselves can do, especially when it comes to muscle cramps. We'll explore that next.
Let's flip the script for a moment. What if the problem didn't start with the pills? What if it started with your sleep? Because long before the leg cramps, long before the blood pressure meds, there's often something else, quiet, chronic, and underestimated. You're just not sleeping well, and that alone might be enough to push your blood pressure out of control. Two of the largest sleep studies in recent years looked at over 1 million adults across multiple countries, and the pattern was clear. People who regularly slept less than 7 hours a night had a 7 to 17% higher risk of developing high blood pressure. The risk was even higher in women and in adults under 60. The younger you were, the more impact poor sleep had. And it makes sense. When you're sleep-deprived, your body doesn't get a chance to reset. Stress hormones stay elevated, blood vessels stay tense, and your heart never really powers down. Your brain may be exhausted, but your cardiovascular system stays on edge. Now layer that over days, then weeks, then years. What do you think happens? You go to your doctor, your blood pressure's up. They prescribe a med, maybe 2. And now the meds affect your sleep, either directly or by messing with your body's natural rhythms. You feel groggy. You start having trouble falling asleep again. You toss, you turn, and the cycle repeats. Poor sleep to high blood pressure, to more meds, to worse sleep. A loop you never meant to enter, and one that gets harder to break with time. Because here's the uncomfortable truth. Sleep is medicine, real, biological medicine. It regulates your hormones. It resets your nervous system. It literally protects your heart. But for millions of people, that powerful medicine is being replaced by chemicals that only mimic rest. Sedation is not sleep. And when we start treating exhaustion with a pill instead of a plan, we lose one of our body's most natural tools for healing. This isn't about blaming you. It's about breaking the cycle. Because the problem isn't that you're weak. It's that your system is out of sync. And it's not going to fix itself with more prescriptions. So if you're caught in that spiral, you're not alone. You're not imagining it, and you're not doomed. But it's time to stop masking the symptoms and start understanding what's really behind them. Because once we do that, we can finally get to the part that nobody warned you about. What the blood pressure meds themselves might be doing while you sleep. That's next. Let's talk about the pills you take to protect your heart. The ones your doctor said you'd probably be on for life. Blood pressure medications. They've saved millions of lives, no doubt about it. But for all their benefits, they're not without consequences, especially when it comes to something you never expected. Those sharp, sudden, middle-of-the-night cramps. You know the ones that hit you while you're sleeping, that twist your leg into a knot and leave you gasping in the dark. For years, people blamed dehydration, or low magnesium, or aging. But now, researchers are starting to look somewhere else, right into the pill bottle. Let's start with one of the most commonly prescribed classes, diuretics. Water pills. You've probably heard of them. Maybe you're on one now. Thiazide, furosemide, hydrochlorothiazide. These drugs work by helping your kidneys flush out excess fluid, lowering your blood pressure in the process. But here's what they also flush out: potassium, magnesium, and sodium. In other words, your body's natural electrolytes, the exact minerals that keep your muscles balanced, relaxed, and firing properly. So when your electrolytes drop too low, the nerves that control your muscles become twitchy, hyperexcitable. They send signals they shouldn't, and you wake up with a leg cramp that feels like your calf is trying to tear itself in half. Now let's look at another group, ACE inhibitors and ARBs. Drugs like enalapril, lisinopril, or losartan. They don't dehydrate you, but they do alter the way your kidneys regulate electrolytes, especially potassium. Too much or too little potassium can both trigger muscle misfires, and when that misfire hits at 3 a.m., it doesn't matter how healthy your heart is. You're on the floor, clutching your leg, wondering what just happened. Then there's beta blockers, like metoprolol or atenolol. These drugs slow your heart rate, calm your system, and sometimes slow down blood flow to your extremities. Reduced circulation means your legs aren't clearing metabolic waste as efficiently, and poor clearance means irritation, tension, cramps. Put it all together, you've got a recipe that looks a lot like what's happening in your body right now. And here's the part that hits hardest. Most doctors don't connect the dots. They see the cramps. They recommend stretching, hydration, bananas. They treat it like a lifestyle issue. But according to clinical neurologists and new data from the University of British Columbia, people on blood pressure meds, especially diuretics, experience significantly more nighttime leg cramps than those who aren't. It's not a theory, it's measurable, and it's being underreported every single day. Because we've been trained to think of blood pressure drugs as neutral, as life-saving, as harmless. But no drug is neutral. No system in your body works in isolation. When you take something to lower pressure, you shift fluids, you shift minerals, you shift balance, and your muscles feel it. So if you've been waking up with cramps, and you're on any of these meds, this might not be about your age. It might not be about your hydration. It might be about the chemistry being rewritten inside your body every night by the very drugs meant to help you. That doesn't mean you should stop them. It means you should understand them. Because cramps aren't just about inactivity. They're not just from getting older. Sometimes they're from the pills you take every single day. And once you see that, you can start having a very different kind of conversation with your doctor. One that finally leads to answers. One that might even stop the pain. But first, we need to talk about how these drugs interact with each other.
What happens when you take sleeping pills and blood pressure medications together? That's where the real danger begins. And that's coming up next.
Let's connect the dots. You're not just dealing with one problem. You're caught in a loop, a quiet, self-feeding spiral that starts small and ends in full-blown chaos. Here's how it usually begins. You're having trouble sleeping. Not every night, just enough that it starts to wear you down. You feel foggy during the day. Your energy drops. You can't concentrate. So your doctor prescribes something to help. A sleep aid. Maybe prescription, maybe over the counter. At first, it works. You fall asleep faster, stay asleep longer. Things seem better. But then, something strange happens. Your blood pressure starts to rise, slowly, then consistently. It doesn't make sense. You've been taking your meds. You've been doing what you're told. But your readings don't lie. So, the doctor adjusts your blood pressure medication. Maybe increases the dose. Maybe adds another one. You go along with it because, of course you do. You want to feel safe. You want to stay healthy. But those blood pressure meds, they start shifting your electrolytes. They change the way your muscles and nerves communicate. They drain out potassium, magnesium, sodium. And then, the cramps begin. Out of nowhere, sharp, sudden, cruel. Usually in the middle of the night. Usually just when you are finally getting some rest. So now, your sleep is broken again. You wake up sore, tired, frustrated. And the next night, you're nervous, afraid of the pain. You lie awake longer. You reach for the sleeping pill because it's the only thing that got you through before. And just like that, you're back where you started. But now the medications have doubled. The symptoms have worsened. And you don't even know which pill is helping and which one is making things worse. This is the loop. Insomnia to sleeping pills. Sleeping pills to blood pressure disruption. Blood pressure meds to electrolyte loss. Electrolyte loss to leg cramps. Leg cramps to more insomnia. Back to the start. A spiral that tightens every night, quietly, relentlessly. And here's the worst part. Most people don't know it's happening. They think the cramps are random, that aging is to blame, that their body is just falling apart. Doctors often miss the pattern. They treat the symptom, but rarely question the combination. So the patient suffers. For months, for years, sleeping less, hurting more, losing energy, confidence, and peace of mind. And all the while, no one ever stops to ask, are the medications fighting the problem or fueling it? Because when a sleep disorder is treated with sedation, and blood pressure is treated without context, and muscle cramps are blamed on bananas and bottled water, people fall through the cracks. You might already be one of them. But here's the truth. It's not your fault. You didn't cause this loop, but you're living inside of it. And the first step to breaking out is seeing it for what it is. Not a coincidence, not bad luck, not just getting older, but a system that's out of alignment, one that can only be fixed when someone finally zooms out
and looks at the whole picture. That's what we're doing here. And now that you've seen the cycle, it's time to talk about how to get free from it. How to work with your body again instead of drowning it in pills that pull in opposite directions. That's coming next.
For years, there's been a quiet debate in the medical world. Should you take your blood pressure medication in the morning or at night? Some experts believed that taking it before bed could better control overnight pressure, that it might even reduce the risk of heart attacks or strokes. But belief is one thing. Data is another. And in 2024, the time trial delivered one of the most important answers we've had so far. It was massive. Over 21,000 participants, randomized, controlled, published in JAMA, one of the most respected medical journals in the world. What did it find? No difference. People who took their blood pressure medication at night did not have fewer heart attacks, did not have fewer strokes, did not live longer than those who took it in the morning. There was no significant difference in average blood pressure, and just as important, no meaningful difference in falls, fainting, or side effects either. So what does that mean for you? It means that for most people, the timing doesn't matter that much. You can take your meds when it works best for your schedule, as long as you're consistent. But if you're someone who struggles with nighttime leg cramps, the story might be different. Because when you take blood pressure meds before bed, especially diuretics or beta blockers, they can influence your fluid balance, your electrolyte levels, and even your nighttime circulation. And for people already prone to cramps, that bedtime dose could be the thing that tips the balance, the final trigger, the last drop in an already full glass. So while the time trial tells us that evening dosing isn't dangerous for the average person, it also tells us there's no added benefit for most people either. Which means, if you're waking up in pain, if your calves are locking up while you sleep, if your sleep quality has dropped ever since starting or adjusting your medication schedule, it might be time to talk to your doctor about switching back to a morning dose. This isn't about stopping your medication. It's about timing it smarter, about knowing that nighttime doesn't always mean better, and that the real goal isn't just lowering your blood pressure. It's doing it in a way that doesn't compromise your sleep, your muscles, or your peace of mind. Because for some people, taking that little pill before bed might be the exact reason they can't sleep at all. By now, you've seen the loop. You've seen how sleep meds, blood pressure pills, and nighttime cramps can collide and trap you in a cycle that no one warned you about. So what do you do next? Here's the good news. You don't need a miracle. You need a plan. And that plan starts with one word: review. If you're over 50, if you're waking up with cramps multiple nights a week, if you're taking a combination of blood pressure meds and sleep aids, it's time to revisit your medication routine. Start by having a real conversation with your doctor. Don't just talk about the cramps. Talk about when they happen, how often, what you're taking, and when you're taking it. Ask if your diuretic dosage could be reduced, especially in the evening. Ask whether your ACE inhibitor or ARB is still the best fit.
Ask if it's safe to shift your meds back to a morning schedule, because small timing tweaks can have big effects, especially when they let your body rest the way it was designed to. Now let's talk about sleep itself. If you're using sleep medication regularly, don't panic, but also don't assume it's your only option. The truth is, most sleeping pills don't fix sleep. They just sedate your brain. And when you force sleep chemically, you risk blunting the very rhythms your body depends on to regulate blood pressure and muscle control. So if you're still waking up exhausted, in pain, or foggy, it's not working. Before you reach for that pill again, ask, have I treated the root cause or just the symptom? Here's what you can try instead. Warm your body before bed. A hot bath, a warm compress on your legs. It triggers parasympathetic relaxation, your body's natural rest mode. Get some gentle movement in the evening. A short walk, stretching your calves and hamstrings. Not intense, just consistent. And consider natural magnesium through food, not just supplements. Dark leafy greens, pumpkin seeds, a banana with dinner. Magnesium supports muscle relaxation and sleep quality without messing with your nervous system. Most importantly, make sleep safe again. Not forced, not drugged, but earned through rhythm, calm, and care. Because you deserve a night where your body is on your side, where the medication helps without harming, where cramps don't snap you out of sleep like a trap, where rest means rest. You've lived too long, fought too hard, and given too much to spend your nights fighting your own legs. You deserve more than sleep with strings attached. You deserve a deep, natural night of peace, not one shaped and bent by pills. Let's help you get there.
3 things that seem separate, that no one ever tells you might be connected. Sleeping pills, blood pressure medication, and nighttime leg cramps. But as you've seen tonight, they don't live in isolation. They form a chain, a loop, a quiet storm that builds in the dark and steals your rest while you're too tired to fight back. This isn't just about discomfort. It's about quality of life, about confidence, about finally understanding what your body's been trying to tell you. So if this video made something click, if you've been living through this, waking up in pain, losing sleep, feeling like no one really gets it, you're not alone, and you're not imagining it. This is real. So here's what I ask. Share this video. Send it to someone you love, especially if they take blood pressure meds or sleeping pills. Especially if they've ever told you, I keep waking up with cramps. This information isn't common knowledge, but it should be. And if you want more content that digs deeper into real science, real aging, and real solutions, subscribe to this channel, because we're just getting started, and no one should have to walk through this in the dark. You deserve better sleep, better answers, and better nights. We'll help you get there, together.
The information provided in this video is for educational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen in this video.